Colony Chiropractic, your home for all your chiropractic needs. Dr. Smith and her staff have been serving the Colony since 1995 and offer a variety of treatments to have you feeling better fast.
I am a graduate of Palmer College of Chiropractic in Davenport, Iowa. I specialize in the Palmer technique, which is a very hands-on approach. I use the techniques mainly that are called Gonstead, Diversified, Thompson, and Activator. I tend to be an aggressive adjuster. I can go gentle on the patients that need me to, but I believe that the more aggressive that I can be, the faster I can get you feeling better. I think that's a win-win situation for both of us. Most chiropractors do x-ray their patients. We do have an x-ray machine on site because I do believe in taking x-rays of most of my patients. I believe the x-rays act as a blueprint. I can see the spine in a much better way than just by touch. I also love for the patients to be able to see their x-rays and see what's wrong with them. Also like to take before and after x-rays on certain cases because even though the patient's feeling better, for them to be able to see how much better their spine has gotten is just kind of an aha moment. We offer chiropractic care, therapies, spinal rehab, and massage in our office. I believe in covering all the bases that I can. A lot of our therapy machines are very relaxing and enjoyable, but they do serve a purpose. We have the roller table, which is intersegmental therapy, and that puts motion between all of the joints in the spine, and that's a great form of traction to the spine. I use it, the analogy that I like to use is a dentist would tell you to floss all your teeth. Well, I'm going to tell you to get on the roller because that puts motion between all of your spinal joints. The electric muscle stimulation is interferential therapy. That's the one that a lot of people know of, the electrodes, and the home unit is called a TENS unit, if you're familiar with that. And that helps reduce pain, inflammation, and muscle spasm, and that is very good for localized pain because we can really set it up right on the area that is bothering you. We also have cervical traction and lumbar traction, or decompression is what it's called, and that is to take pressure off of the discs, the pinched nerves, and to stretch the muscles. So a lot of people do really well with those. We also have aqua massage, which is a machine that you lay on and you don't get wet, but water pounds down on you and it goes up and down your entire spine, and it's very relaxing, but it is increasing circulation in your body and also decreasing muscle tension. We have cold laser therapy, which is the new technology that's pretty much taken the place of ultrasound in the old days, and it is a light stimulant to the area, and it helps the healing process. We also do spinal rehab, which is a series of stretches and strengthening exercises for the spine. So it's very important to stretch our tight muscles, but it's also very important to strengthen the weak muscles of the spine as well. We do offer supplies for the patient to take home and to use, anything from ice packs to BioFreeze. We have TENS units. The cervical pillows, the lumbar pillows, they're all a very important part of your care. The more you use them at home, the quicker you're going to heal.
There are several things Dr. Smith recommends that you can do to promote your overall health and wellness.
Your medical doctor will absolutely suggest you do cardiovascular exercise, which we, of course, would also suggest, but so many people don't realize the importance of stretching. If you don't use it, you lose it, and we get very stiff with age. And so one of the most important things you can do is some form of stretching every day. Yoga is a great form, Pilates, things like that is wonderful, but just simple stretching would be wonderful. The piriformis muscle is a tiny muscle that lies underneath the gluteal muscles, your butt muscles. And when it gets tight or goes into spasm, it will impinge on the sciatic nerve. And everybody knows what sciatica is, that pain that goes down the back of the leg. So a lot of times it's from this tiny little muscle. So it's a very important stretch that we teach all of our low back patients. For the piriformis stretch, you need to sit in a chair and make a figure 4 with your legs. You'll put one hand on your knee and the other hand on your ankle. The foot that's on the floor needs to be lined up with the center of your body. Then you'll lean forward just to the point where you feel the pain in your low back. Once you're there, you count to 10 and you're going to hold that position. After 10 seconds, you should be able to go a little bit farther forward. And then you hold that for 10 seconds. And then you should be able to go a little bit further. You hold that for 10 seconds. You do this for 1 minute, and so that equals 6 increments of 10. When you start, you may be sitting almost upright, but as you stretch that piriformis muscle, you'll find that you're able to bend much further by the end of that minute. Even if your low back pain is only on one side, you do need to do this stretch on both sides. So it's for 1 minute on the left and 1 minute on the right, and we suggest you do it at the top of every hour to help you remember. Patients always seem to be confused whether they are to use ice or heat after an injury. The rule of thumb is that for the first 2 days, you always want to use ice. After that, you have to decide whether the problem is stemming from a joint or a muscle. If it is a joint, we always advise you to use ice because there's going to be inflammation in that joint. If it is truly a muscle, though, you can use heat on that. Ice is going to be 20 minutes on, 20 minutes off. And as far as how many times to use it, I always tell patients to rate their pain. If their pain on a scale of 0 to 10 is a 6, then they need to do their ice 6 times that day. If it gets better and it goes down to a 3, they still need to use the ice 3 times that day. We're always going to be using ice here in the clinic because we're working on the spinal joints, and always there's going to be some form of inflammation in those injured joints. So ice is always our treatment of choice here. Occasionally, our massage therapist will suggest heat on injured muscles as well. The majority of people are working at desks nowadays, and some larger companies have ergonomic departments or safety departments, but a lot of the smaller businesses do not, and so patients are sitting at desks that are completely set up the wrong way. We have a form that we hand out that helps people. Every new patient gets it so that they can go and correct their desks the best they can, but the main thing that we preach is that you're supposed to sit straight with your shoulders back, and your arms are supposed to drop down to your sides as if they're hanging there. So many people are reaching for that mouse and holding that right arm up all day long, and that's not where it's supposed to be. The arms are back, or shoulders are back, pardon me, arms drop, and your elbows are supposed to be at your sides, and then you have a 90-degree angle at your elbow, and then your keyboard's supposed to be right in front of you, and then the mouse just barely to the right of that, or left if you're left-handed, but to the right of it usually. Your monitor is supposed to be positioned right at eye level. You can give or take an inch or above or below is fine, but it really does need to be at eye level. So many people are looking down at their monitors. Let's see what else. Their feet, you do not want them dangling because your knees are supposed to be at 90 degrees as well. You do not want them dangling, and you do not want your chair so low that your knees are up above 90 degrees. To correct your desk ergonomics, you do not have to purchase expensive equipment. You can raise your monitor up with textbooks like we have, or you can even throw a phone book down on the ground to use as a stool. It doesn't have to be expensive equipment. No one has been taught how to sleep the right way. We don't have anybody that gives us that lecture. Stomach sleeping is the absolute worst thing you can do for your neck and your back, so no stomach sleeping. The best is going to be sleeping on your back. You need a good cervical pillow under your neck, those to support not only your head but your neck, and then you do need a pillow underneath your knees. Knees need to be bent to take the pressure off the low back. Now, if you can't fall asleep on your back, or if that's uncomfortable, then you can sleep on your side. That's a neutral position, and so that's fine, but you need to have a pillow between your knees, and you need to be hugging a pillow as well. That's why we recommend the body pillows, but also you would still be sleeping on a cervical pillow on your side as well. However, if you do want to sleep on your side, do not sleep with your arm raised above your head. That can cause neck and upper back pain. You also don't want to sleep with your knee cranked over in front of you because that twists your low back all night long. It would cause some low back issues. Another sleeping posture to avoid would be the fetal position because your shoulders, elbows, wrists, and knees are all bent, and those are definitely not relaxing positions for those joints to be in all night long. Many patients are confused when it comes to buying their mattress. I always suggest a major brand name, Sealy, Serta, Posturepedic, Tempur-Pedic, something that you've heard of. We also suggest that the mattress be as firm as possible, but it does need to have a pillow top. We want the support for our spine, but it does need to be comfortable. I believe in this so much that I write prescriptions for my patients to buy firm mattresses, and that saves them the sales tax. We're very much a family practice. We treat newborns to geriatrics. My youngest patient would be my own children that were adjusted the day they were born, and the oldest is a 97-year-old woman that we adjusted. We treat sports injuries, we treat athletes, we treat motor vehicle accident victims, you name it, we can help them.
Colony Chiropractic, your natural path to restoring and maintaining optimum health.